She's a naturopath, certified clinical nutritionist, and she does a great job of helping people really change their lives. And we're really lucky to have her as a speaker on our team. She has a beautiful medical spa down in Boca Raton, and we're excited to announce, so Dr. Brazelia Lazzari back and better than ever.
Ladies, put your hands on those hips. Let's go. Shake them. Shake that pelvic floor. That's it. Woo! Right? That's what we need to get. Some flow, some blood, some vasodilation there. Knees up. There we go. Back to this. So let's go. Woo! Because you got the light now. You got the light now. Hips. Oh, my girls. There we go. All right, let's get this show started. I'm Dr. Brazelia Lazzari. I'm with Brazelia Integrative Anti-Aging Center in downtown Boca Raton, Florida, where we have an integrative wellness facility, and that's my model. My model is really on prevention. That's what it's all about today. Prevention far outweighs having to cure anything. So I speak the walk, I talk the talk, and with integrity, I do as I say and I say as I do. So these are my credentials. I was a professional student forever. I just love studying because just like technology, you know, you learn something new today and it's already outdated and you have to learn something new again. So here we are, integrative medicine. We know healthcare is absolutely undergoing, we can say a crisis, whatever that may be, it's here. So either we adapt, we acclimate, or we change and move forward. I always say, I also like to do motivational speaking, and I'll explain the I am a happy affirmation in a second. But if we fail, is that a bad thing? No. We don't fall backwards, fall forwards, and you keep getting back up. It's easier to get back up. And that's where I love to really focus on with medicine, because the body is so complex. And so with that being said, we're gonna go into a lot of different topics. I'm gonna try to cover as much as I can from A to Z on women's wellness, from menstruation to fertility, pregnancy to menopause, well, perimenopause, menopause, and then what therapies we have to help our bodies, okay? So integrative medicine is basically the interaction of the provider-patient interaction, where we're focusing on mind, body, and spirit. We're taking the entire composition of the person, looking at their biochemistry, assessing what's going on, and listening to their symptoms as well. Because a patient will understand, for the most part, what they feel. And our body is a diagnostic tool. So you have to listen to the patient. That's a part of being a physician. Unfortunately, sometimes we get so caught up. It's, you know, you got another patient, and so you're rushed through that. But listening is vital to the entire therapy of that patient. So what is functional medicine? Similar to integrative medicine, but we're really focusing on the root cause. Finding out exactly what's going on through testing and other modalities to see exactly where we're looking at fixing or trying to balance out areas in the body. So it says here, every patient is a unique individual, so their conditions should be treated as such. Science-based goes deep into biochemistry, dysfunction, and genetic predisposition to certain conditions. We're going to talk about genetics. We touched on the MTHFR, really important, because when we're looking at labs sometimes, they can give us a story, but not a complete story, and the patient often leaves feeling not well, and the labs look good, but then we start to look at other areas in the body, and there's certainly a lot of tests. Genetics are one of them. Okay, so let's get into hormones. We've been talking about hormones. It's all about the hormones, essentially. What is a hormone? Let's, 101, okay? They're hormones, they're messengers. They're chemical messengers used in the body by the endocrine system. They coordinate our organs, and hormones are produced by glands. We saw this chart earlier, Cholesterol is the it's the hormone that is a precursor to pregnenolone, known as the master hormone. And then you can see here the entire hormone synthesis from there. DHEA, also known as a master hormone, where you have your androgen steroid and your estrogen produced as well. So we're going to go through that entire cycle because I like for people to understand the entire process. How is this happening? How is this working in my body? Here we have your hypothalamus that sends a message to the pituitary gland by the neurosecretory cell to help produce stimulating hormone. You can see here, thyroid stimulating hormone produces thyroid. Adrenocorticotropin hormone, adrenal cortex. Follicle stimulating hormone and luteinizing hormone, testes and ovaries. Growth hormone, the entire body. Prolactin, the mammary glands, and endorphin, your pain receptors. Here we go. What does it regulate? Extracellular fluid, metabolism, the biological clock, contraction of cardiac and smooth muscle, glandular secretion, immune function, growth and development, and reproduction. So here it is, an entire composition of gland, hormone type, and the action. So we can see here hypothalamus, oxytocin is up there, antidiuretic hormone, and so on and so on. I'm not going to go through all of them, but you can see what types they are. Okay, so there are many different areas that you can see in the body that the endocrine system is involved in. Okay, thyroid. We talked about thyroid today, and I'm going to really hone in on the thyroid. Very important gland, very important gland. I'm in between two slides here, so okay, bear with me. So again, hypothalamus, the relay station sending the message, thyroid stimulating hormone, producing thyroid gland, producing the T3 and T4. The function increases metabolism, growth, and development, increased catecholamine effect. Okay, that's your norepinephrine, epinephrine from your adrenal glands. So 5 levels of your thyroid hormone pathway. Hypothyroidism and Hashimoto's thyroiditis. That's a big one. That is not to be taken lightly. I can tell you personally from personal experience with my son, he developed Hashimoto's disease. I didn't realize how severe it was. It gave him a severe depression. I mean, he's 27, his testosterone dropped. It was a cycle of different things until we assessed. I looked at his thyroid peroxidase and I said, oh boy. We immediately started, boosting him up with actually thyroid support, with thyroid medication, and actually had to give him testosterone injections. He's back to normal, of course, but it is very serious. So what happens to the thyroid? What blocks these areas causing these issues in the thyroid? If you look, it's hard to see on the slide. I know it kind of looks a little blurry, but you have the slides in front of you. Thyroid peroxidase enzymes become inhibited. That's how TPOs, that's how we're able to assess, whether there's a Hashimoto's or not. Your liver, iodinase enzymes become blocked, and actually, when they become blocked, there's an inactive R3, which we're going to talk about in a second, that actually competes with one of the other receptors. So there's an issue there. Your proteolytic enzymes, your pancreatic enzyme, trypsin and chymotrypsin also become blocked. So that's, remember, endocrine glands. I'm going back and forth because I want to go through. Let me finish with the bloodstream on the thyroid. Thyroid transport proteins become blocked. Your cell receptors become blocked. Your metabolism becomes blocked. You can see how important the thyroid is. So we want to make sure that we are always checking your thyroid levels, and we're going to talk about some symptomology as well. So here we are, factors that affect the thyroid function. Okay? Factors that contribute to proper production. So we need these nutrients, which is in the thyroid complete. Iron, iodine, tyrosine, zinc, selenium, key, selenium all day for the thyroid. Factors that increase the conversion of T4 to reverse T3. Stress. No one here has stress today, right? Trauma. Low calorie diets, that's a big one today. Everyone is on some sort of fad calorie diet, and some are good for you and some are not. Inflammation, toxins, infections, liver, kidney dysfunction, certain medications. So they inhibit the thyroid hormones. Okay, toxins, fluoride. Where's fluoride? In our water. Okay, plastic bottles. Sex hormones, release process. We're gonna start going through these slides quickly, and if we have any, because there's 184 slides. So I'm gonna go through them as quickly as possible, and I'm going to try to slow down because I start to tend to want to talk about everything, and I know I have to stick to my slides and my time. So if there are any questions, ask me at them, write them down, so that way I can get through the basis of the seminar and then cover as much as I can. So when we're looking, because we're going to start going into the hormones and the menstrual cycle, gonadotropin releasing hormone is secreted from the hypothalamus, which stimulates follicle stimulating hormone and luteinizing hormone. We can see here that the follicle stimulating hormone and luteinizing hormone stimulates the follicle growth in the ovaries. Alrighty, and then estradiol, progesterone, and inhibin are secreted from the ovaries. So let's get into the menstrual cycle. Oh my goodness, is it getting near that time again? Look at her horns. There's something, has anyone heard of something called FS? It's called fight starter. My husband named that because that's typically what happens. Our hormones are surging, they're kind of, increasing, decreasing, and we feel irritable, we feel crampy, we're not feeling good. So it's known fact that when that menstrual cycle starts to occur, we start to feel a certain way. Okay? The menstrual cycle is more than just a period. It is the period is just the first phase of the cycle. It's made up of 2 cycles that interact and overlap, the ovarian and the uterine cycle. The brain, ovaries, and uterus work together and communicate through the hormones to keep the cycle going. So this is the entire menstrual cycle, okay? Classification of the different phases. Phase 1 is when we consider the uterine cycle, which are days 1 through 7. And this is when menstruation occurs, which is the shedding of the uterine lining. Okay, this is when we have lower levels of estrogen and progesterone. Okay, then we go into the follicular stage, which is now becoming an ovarian cycle, which are days 8 through 11. So this is when this is the time between the first day of your period and ovulation. So estrogen rises as an egg prepares to be released. Okay, now we go into the ovulation stage, which is approximately days 12 to 17, and this is when the release of the egg from the ovary mid-cycle occurs, and estrogen peaks just beforehand, then drops shortly thereafter. We're going to go into the luteal phase, which are days 18 to 25, still in the ovarian cycle, and that's the time between ovulation before the start of your menstruation. The body prepares for a possible pregnancy. Progesterone is produced, peaks, then drops. So here we have the actual graph. You can see here, these are the menses, proliferative stage, secretory stage, and premenstrual phase. This is exactly the cycle that's happening in the menstrual area. So what happens is, if that luteinizing hormone creates that corpus luteum and the egg is fertilized, we have pregnancy. Okay, so let's go through that now. What happens during pregnancy? When there's fertilization that happens, and let me find this here. Oh, that's not good. There we go. Okay, good. So what happens is, here's the ovum, this is the egg, this is ovulation. This egg is actually released into the fimbriae here, into the fallopian tube. We're gonna let's find that there. There it is, okay. This is your sperm cell, okay. You can see here the ovum is picked up, the ovum is released from the corpus luteum there, and it's released from the ovary into the fimbriae. Sperm travels through the vaginal canal, and they meet each other. And they say, hey, you look good, I like you. And then they start traveling back down to the uterus where it gets implanted for pregnancy. Okay? That's how it occurs. And these are the hormones of pregnancy. That's how we know that you're pregnant. HCG, human chorionic gonadotropin. You test that, voila, you're pregnant. And these are the hormones that start to surge. Progesterone, you can see progesterone starts to increase later on. These are the different trimesters. So we have 3 trimesters in pregnancy. Okay? Acupuncture for fertility and stress reduction. Excellent. Excellent, excellent, excellent. I love acupuncture for fertility because it really makes a difference. It's about helping to release the stress, I mean, we do testing to find out exactly what's going on with their hormones, but it makes a difference. We have something called tianquei right into this area, the pelvic area, also known as the core, to really help with movement, blood flow into that pelvic region, which we'll talk about later. It's called the pelvic floor. And acupuncture has been known to really help with boosting fertility rates, paired very nicely with an IVF clinic. If there's dysfunction, it makes a huge difference. I've had many women, they say, I have your baby, I'm bringing your baby today because we've helped, with the fertility cycle, and it's a wonderful thing. So let's talk about methylation. We've heard about methylation today. So exactly what is it? It's the core process that occurs in all of your cells. It's about cellular adaptability, gene regulation, and detoxification, okay? So it makes the biochemical conversions in the body that regulate the activity of the cardiovascular, neurological, reproductive, detoxification system, including those related to DNA production, fertility, neurotransmitter production, because we're dealing with the B family, detoxification, as I've mentioned, fat metabolism, cellular energy, and liver health. Okay, so we can see here, cellular repair, the synthesis of nucleic acids, production and repair of DNA and mRNA, messenger RNA, healthy immune system, formation of red blood cells, folic acid, that's the main one that we're looking at. And when folic acid cannot be broken down, this is what happens. We talked about glutathione, your master antioxidant, vital. Those areas cannot be efficiently produced. So we look here, glutathione, CoQ10, nitric oxide, vital, L-carnitine or epinephrine, serotonin. We're going to be talking about these earlier. When the methylation switch is turned off, it isn't creating enough SAMe, then a number of these important molecules cannot be efficiently produced. Energy, you have a product out there that helps you with that. So we'll talk about the products towards the end. So this is our B cycle, okay? They control the energy production, stress response, fight or flight, the production of the body's master antioxidant, neurotransmitters and regulation of brain chemistry, the repair of cells that have been damaged by free radicals, the body's inflammation response. I mean, the T cells, that's a lot of different areas that this is covering. This is vital. And how can you assess? You can do it through urine, a swab, blood testing. It is vital. That's why I'm all about the genetics today, because you can see how many areas we could possibly be missing to address without knowing that vital piece of information. Okay? So how does this gene affect pregnancy? Okay? We talked about homocystinemia earlier today. MTHFR handles the breakdown of the vitamin folic acid, which leads to levels of homocysteine, okay, and it can become high, which is an amino acid. And what happens is, if these levels are very high in pregnancy, they can cause miscarriage, preeclampsia, birth defects. That's huge. We want a healthy, happy baby. Testing is vital, really to assess what's going on in your body. Even if you're not feeling a certain symptom, ask, hey, do you guys do genetics? I'd like to test that genetic marker, please. Okay. Let's get into estrogen, our main hormone. So there's actually 3 types of estrogen: estradiol, estrone, and estriol. Estrone is typically for menopausal women, estriol is for pregnancy, and estradiol is the most common, the main hormone. Okay. So here are the 3 main sex hormones: estrogen, progesterone, and testosterone. Estrogen is the 3 hormones we just mentioned. The goal of progesterone is to thicken the uterine lining and prepare it to receive a fertilized egg after ovulation has occurred. Role of testosterone, commonly known as responsible for sex drive and responsible for female libido, which we're going to talk about later on. After we're going to take a 5-minute break in about an hour. So let's look at estrogen hormones. These hormones regulate many bodily functions. Estrogen production is made in the ovaries, okay? Estrogen function produces, it helps preserving bone density, encourages hair growth, sustains normal body temperature, obviously reproductive health. When we have imbalances, we have irregular periods, hair loss, mood swings. Imbalanced treatments, options include lifestyle changing, alternative medicine, which is where we're here today with respect to functional medicine, integrative medicine. Okay? Estrogen action. So you can see all the different areas that estrogen is involved in. Muscle strength, preventing atherosclerosis, ovulation, increase in fat stores. We'll talk about that later. We don't want fat stores, but we'll talk about how to address that. Increased cholesterol in bile, breast development, estrogen made by ovaries and adrenal glands. Okay, so there's a lot of actions that occur with estrogen. However, as we age, the estrogen starts to drop and all these nuances start to occur, which we're not crazy about, but is a part of life and we have to prepare for it. Knowledge is key because once that happens, you know where you need to go with respect to preparing for that. So here we are, age 20, you can see we're full of estrogen. Age 30, we have tons of estrogen flowing through us. 35, we're roaring. They're saying always the 30s is the best cycle with respect to libido and things of that nature. 40s, you're starting to decline a little bit. 50, you can see the decline, 60, 70, and 80. This is when we're starting to go into the menopause. Here is where perimenopause starts to kick in, then menopause starts to kick in even later on. Most women on average, about 47 to 48, you'll start to see a perimenopausal symptom. Average 52 is when menopause starts to kick in. So the role of estrogen and progesterone, as we've been mentioning, you can see here estrogen affects, it builds up the uterine lining, increases body fat, depression, headache, migraine. This is what estrogen effects are. Increased risk of breast cancer, very important. We'll talk about that in a second. Impairs blood sugar, increases the risk of endometrial cancer. Progesterone effects, maintains uterine lining, helps with fat storage, antidepressant, normalizes blood clotting, facilitates thyroid hormone action. I mean, you can see it prevents breast cancer. They're different because women sometimes don't understand the effects of what estrogen does or what progesterone does. Everyone always knows what testosterone. Testosterone is known as the libido hormone. It does so much more. But with respect, because I ask women, I'm like, do you understand what estrogen is doing in your body? Do you understand what progesterone is doing? So I like to really highlight the features of the effects of both hormones. So here we have healthy and unhealthy hormones. You can see here, progesterone, thyroid dominance, increased resistance to disease, good health, strong metabolism. Unhealthy, which is what we consider estrogen dominance, okay? Poor digestion, weight gain, PMS, infertility, edema, varicose veins, and increased cancer risk. So we need to make sure through testing, again, testing, I'll keep that going, to see exactly where your hormones are at. And don't think, oh, well, I'm young, I don't need to test my hormones. If you're feeling any types of symptoms of any kind, it is imperative to ask your gynecologist or your physician, can we check my hormones? I have had women in their 20s have issues with hormones. Okay, so it doesn't matter if you're 20 or 60, try to get your hormones checked. Please, that's vital. So here we have early signs of estrogen dominance, bloating, swelling, decreased sex drive, that's a big one, irregular menstrual cycles, headaches, mood swings, weight gain, hair loss, difficulty with memory, feeling tired. You can see on and on and on. What causes estrogen dominance? Processed food, alcohol, stress, cleaning, agents, many things. Hair and makeup, just products themselves can cause a lot of these hormone imbalances. Here we go, xenoestrogens. These are the bad estrogens, the unwanted estrogens. We want a good receptor site of estrogen here. This is literally binding to a receptor site. This is a xenoestrogen that can possibly cause cancer. So we definitely don't want that. And so I'm all about the alternative medicine. how we can really help our bodies with way of supplementation, functional medicine, and with foods. So here is a list which I give to my patients all the time. When I sit with a patient, I'm addressing their conditions. So what do? I give them information, because if I'm talking to, they're inputting that information along with the entire lab that I'm going over. Do you think that everyone's going to remember everything I say? Of course not. So therefore, I give handouts, I have slides, I show them graphs, so that we can have that visual that's actually inputting, and you have more retention in that capacity. So here are anti-estrogenic foods, okay? These are citrus, allium, this is the onion family, healthy fats, herbs, cruciferous vegetables. There's sulforaphane in there. These are excellent foods to help reduce or balance estrogen hormones. These are foods that are rich in estrogen. So if we have an estrogen dominance, what do we want to do? We want to stay away from these or modify these foods. Or if you're low in estrogen, quite the reverse. So these are phytoestrogen foods. You can see here from the fruits, vegetables, grains, seeds, herbs, and spices. Let's get into fun nuance of menopause. Who here is familiar with menopause? This has been a topic that women suffer through. Unfortunately, some women don't understand what's going on in their body. We know it's a fact of life. 10 out of 10 women go into menopause, and 10 out of 10 men go into andropause. There's no skirting that, unfortunately. So we have to either go through it gracefully with knowledge and know where to navigate through with what therapy is needed for you, or a lot of women suffer through it, unfortunately. And we're going to go into the relationship section at the end, well, when we're talking about the sexy and bringing your juice back, your juicy back, but that's often what happens in relationships. Women just don't feel it. Their biochemistry is just not there. So they're saying, I don't love the husband. I tell couples, give me 2 months. Let's restore hormones first and then get back to that situation, because that makes a big difference. Okay, so let's go through the symptoms of menopause. Anxiety, depression, headache, decreased libido, fatigue, insomnia, vaginal dryness, memory lapse, osteoporosis, weight gain, irritability, hot flashes. Oh my gosh, that sounds like fun. Here we have perimenopause. Perimenopause is leading into menopause. That can happen, it can take a year, some women a little bit longer, where they have skipped menstrual cycles. They'll have a menstruation 1 month and nothing for 3 months, and then nothing, and they'll have, back to back. It's irregular cycles where you're starting to feel, okay, I'm not feeling right. There's some symptoms going on, as we mentioned on the previous slide. Then, after you have not had a menstrual cycle for 1 year, that is when you're leading into menopause. And there are also markers that we check for as well. And then postmenopause is anything thereafter. So we look at your follicle stimulating hormone. Normal, that means you're not in any form of menopause as of yet. Perimenopause, those are the ranges that we're looking at. Postmenopause, we know that you're in a full menopause at that point when we're looking at those numbers, okay? So, this is what's happening. That's what we feel like sometimes, women, when we're going through a perimenopause state, because we're used to having these surging hormones, and now they're starting to drop. So you're going to start feeling, and there's an interconnection with the entire body. We're going to talk about the neurotransmitters and that interconnection later on. So skipping periods, as we just mentioned. Okay, so menopause is a time that marks the end of your menstrual cycle after 12 months. So basically, strictly speaking, it refers to the 5 to 10 years when the ovaries gradually stop producing eggs and there is a progressive decline in the hormone production, obviously speaking on estrogen. So now, let's go into this slide. Menopause age ranges. You can see here, 45, as I mentioned, anywhere about 45 to 47 is where you're starting to go into that menopause state. 52, and then from there on, this is when you start to have more of the stronger effects of osteopenia, possibly osteoporosis. So let me introduce you to the 7 dwarfs of menopause. Itchy, bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. Who wants to stay that way? No one. Of course not, women. So we need to focus on what we need to do to get there. Right? I mean, nobody wants to feel it, but that's what happens. And in menopause, you're losing hormones, notably estrogen. So we need to repair those cycles. And there's many different areas of medicine today to help that cycle and that production. And we're going to talk about bioidentical hormones and things of that nature. So when we look at key performers of estrogen, progesterone, and testosterone, you can see here the low estrogen or estrogen fluctuation triggers hot flashes, night sweats, palpitations, foggy thinking, memory lapse, and the vaginal dryness. We talked about progesterone and estrogen dominance. Low testosterone leads to bone or muscle mass, metabolism, energy, strength, stamina, exercise, tolerance, and libido. So we need to definitely start looking into where we're lacking, what hormone is at is in disbalance. When that happens, when we start to lose estrogen, we start to gain weight, typically, notably in the midsection, okay? So what are the hormones that are involved in that? 6 hormones that completely change our weight and health. Insulin, helping to regulate the sugar cycles. Leptin, the satiety hormone. Glucagon, the reserve of blood sugars. Cortisol, our stress hormone. Ghrelin, our hunger hormone. And testosterone. Let's go into that cycle. Here's your hunger hormone cycle. Ghrelin is your hunger hormone that sends a message to the brain saying, hey, I'm hungry. So now you eat something. Stomach digests the food. Okay, now it has to be absorbed through the body. So incretin is produced to send a message to the pancreas to stimulate insulin hormone. That insulin hormone is going to give energy to the cells, so it's going to give energy to the muscles. There's also a reserve of sugar that happens in the liver, glucogenolysis. That energy storage now is also with the adipose tissue, and that adipose tissue releases another leptin hormone that says, I'm not hungry anymore. That's your satiety hormone. So that's telling your brain, I'm full. So that's the entire hormone cycle. Leptin is huge. Leptin will, if there's a dysfunction in leptin, guess what happens? If it's the satiety hormone, you're not satiated. You're feeling hungry all the time. So there are absolutely functional supplements that help that leptin cycle. I work with that all day long, because if you put someone on a healthy eating plan, I like to say that instead of a diet, a healthy eating plan, what happens? What's the main thing? I feel hungry. I can't do this. We make sure that that leptin cycle is in check, and we also check it in labs as well. Okay, here's the leptin cycle. Look how many areas that leptin cycle works with. That's a lot. Helps regulate the synthesis of thyroid hormones. You can see it just goes on and on. It regulates menstrual cycle. It makes a huge difference. So leptin is vital. So that's another test that you should have. And if there's a dysfunction there, you'll know. If you're that one that constantly has to eat, I'm hungry, I'm hungry, I'm hungry, you're not feeling satiated, there's a leptin dysfunction. Okay? So let's look at the hormonal links to weight gain again. Again, we talked about thyroid today. If there's a thyroid deficiency, we all know if there's a thyroid deficiency, either you gain weight or you lose weight. Estrogen dominance, typically in the hips, okay, thighs and breasts, in that midsection right here. If there's an androgen imbalance, loss of the lean muscle mass, okay, insulin resistance, you have to look at your insulin level, your A1C, your measurement of your blood sugars, and your vitamin D deficiency. That's also a big one. I have so many patients that are low on vitamin D. And we live in a sunny state here in Florida. But obviously not everyone's in the sun, and it's not as readily absorbed into the body. Very good just to take a vitamin D supplement. Amazing for the immune system, especially now with this whole pandemic that we've gone through. All day long, either you're doing a vitamin D shot or you're taking a supplement, a natural supplement for that. So let's talk about balancing those hormones, because we don't want to be the 7 dwarfs. We don't want to be itchy, bitchy, all dried up, right? We want to balance those hormones. So let's talk about these. We talked about a lot of imbalances already. Chronic fatigue is the main thing I hear. I'm exhausted. I just don't have it. my sex drive is to the, down. There's so many nuances that we're looking at with respect to imbalances with hormones. So now let's start to address them. These are the symptoms, okay? We know we've gone through these already, so these are repetitive. Your foods could be throwing your hormones out of whack, okay? Estrogen dominance, unfortunately today, meat is not of the capacity that we need it to be unless you get it from good sources. We know that a lot of these animals are injected with hormones, so it does affect us. Sugar, it's not the omen, but it does wreak havoc in the body. Glycation, we heard that earlier today. Too much caffeine, cortisol levels, grains, unfortunately. Our grains are, we're now transitioning more towards gluten-free diets and certainly toxins. So let's go through this. This is the cortisol, testosterone, unbalanced hormones. So women ask me, do I have bat wings? Or why am I going? This is why. Arm fat, high insulin, low DHEA. Chest fat, high estrogen, low testosterone. Body fat, you can see the love handles, high insulin and blood sugar imbalance. For men, we're gonna go through chest fat, high estrogen, low testosterone. We have a product for that. Who remembers Testo 180? Very good product. Arm fat, high insulin, and you can see on and on and on. So when we start to look at different areas, you can also assess what's going on with someone based on these areas. So the hormones interact. You can see the interaction here. Hormones affect each other. They interact and they balance with each other. We spoke about thyroid hormone, your metabolism, your thermal regulation, your cortisol, your adrenal glands. When we're in menopause, your adrenals are the production of the hormone, the remaining hormones that you do have. Estrogen and progesterone, testosterone, and insulin. So we look at ways to correct these systems. How can we address and help the thyroid? We're gonna talk about those products later on. We spoke about them earlier. Nutrient replacement, amino acids, minerals, exercise, healing, stress management, meditation is key. Our society is a very fast-paced society. We're all out here. What's going on? We're busy, home. No one is in here anymore. We need to come back into our bodies to understand what is going on, feel what's going on. And that's unfortunate because I have so many women that are just, they're out of tune with their body because they don't understand it. When you don't have that in tune state, we're gonna talk about that with vibrations and frequencies later because that's really important. I get into a lot of different topics and I wanted to really address bits and pieces of a lot of them to put them together and really make a big impact with women, okay? So hormone balancing wheel. Thyroid, Brazil nuts. Brazil nuts are very high in iron and selenium, okay? Although they can be fat, so be careful. Don't eat a lot of them. They're delicious. We have PCOS, polycystic ovarian syndrome. Flax seeds, believe it or not, are very good for them. They help to minimize the reduction of these cysts in the ovaries. Okay, broccoli sprouts for estrogen dominance. Sulforaphane is a potent antioxidant. Very, very good. Here we have the adrenals. This is the adrenal. Camel, it supports adrenals and fights adrenal fatigue. Menopause, maca root. Lots on maca root. It really helps menopausal symptoms, hot flashes, and interrupted sleep. Okay, so you can see here, vitamin D all day long. Chaseberry, Vitex, your omega fatty acids. There's a lot of things that you can do with respect to natural supplements, with respect to whole foods, because I love whole foods. Unfortunately, today you have to be careful. There's hybridization. There's a lot of things going on. Do your best to get organic, if possible, and really get a good quality source of food. But you can see here, libido, maca is very, very good for libido. It's a Peruvian herb, and it really makes a difference. And then here you have estrogen, progesterone, follicle stimulating ratio. You can look at these on your slides. 9 ways to boost your progesterone. Lots of stuff there, okay? You can see here, vitamin C. I get that a lot. What vitamin is for what? What can I use that vitamin for? So 9 ways to boost your progesterone. Vitamin C, magnesium, vitamin B6, sulfur or L-arginine, which is the precursor to nitric oxide, zinc, vitamin E, good cholesterol. We talked about eating eggs, fiber. So you can see there are many, many different ways to really help your hormones. Here's another one, top 10 hormone balancing foods. We talked about coconut oil. Other ways here we have, we're going to talk about hemp CBD shortly. Acupuncture. Acupuncture has 12 meridians in the body, which can really assess the energy pathways. So that is very, very good. Okay, there we go. Here's our hemp. I love hemp. I'm a cannabis advocate. I lecture at many of the cannabis expos. We also offer medical marijuana recommendation in my practice because I see it as medicine, and it makes a huge impact for those that need it. PTSD all day long. We're working on that. We have hemp CBD. Hemp is amazing. You see that those products back there. People don't understand the benefits and the power of hemp CBD. Look at this. I mean, there are a number of amazing benefits, but it was FDA approved for epilepsy, which is why it was brought to the forefront of medicine today, with massive impact. And that's another story. Charlotte's Web, if whoever's familiar with that, with little Charlotte. But we'll go into that another time because I want to have just another seminar with that alone. But let's talk about these. Okay, benefits of CBD: anticonvulsant, suppresses seizure activity, antiemetic, reduces nausea and vomiting. I use this a lot with my patients. Antipsychotic, helps to combat psychosis disorder. Antioxidant, okay, anti-anxiolytic, antidepressant, anti-inflammatory, anti-tumor, anti-cancer, pain management, pet friendly, great for dogs. I have a lot of really, really great success with CBD and pets. Okay, so it's been used since 1800s, okay? Cannabis indica has been around for a long time. And just to kind of give you a little insight, you have your cannabis hemp plant. Within your cannabis hemp plant, you have CBD, THC, terpenes, and flavonoids, okay? That is encompassing the entourage effect. They work synergistically together. When we're taking out the THC component of that, that creates what we consider a broad spectrum. When the THC is put in, and CBD today can have THC in there, 0.3 is the trace limit amount that you can have it, and it's non-psychoactive. That's considered a full spectrum. Okay, so the earliest written records of gynecological uses of cannabis date back about 4,000 years to ancient Mesopotamia and Egypt. Egyptians were way advanced. I mean, you see those beautiful clip earrings that they were wearing and all those dangling. Actually, that was a form of auricular therapy. They were accessing many different points on the body through the ears because that's a microsystem. Your hands and feet are microsystems, so you can access your entire body through those areas. So you can see here all the different benefits. These archival medical texts from 1800s describe different cannabis formulations that were effective for aphrodisiac uses, painful menstrual cycles, heavy bleeding, painful urination, pain during sex. I mean, you can see how many beautiful ways that it helped all those areas naturally. That's the big deal because remember, it's an herb. So it's known, hormone imbalances can occur naturally during puberty, menopause, and perimenopause, but that's not the only reason. They can also be caused by toxins and an unbalanced lifestyle. And unfortunately today, life as we know it isn't as easy, and so there's a lot of imbalance with respect to illnesses today. And so we have great products to combat that. In one study investigating the effects of CBD on plasma prolactin, growth hormones, and cortisol, researchers found that CBD helped to regulate the secretion of cortisol, the stress-activating hormone. So the studies concluded that these effects are consistent with cannabinoids' impact on the brain neurotransmitters involved with the regulation of the pituitary hormone secretion. So when we're looking at the endocannabinoid system, which is what we call a universal regulator, we have endocannabinoids in our body. Phytocannabinoids are from the plant. So they're saying that these areas are the CBD, when it comes into our body, immediately attaches. And CB1 and CB2 are our receptors for CBD. So it's getting into the brain. And because it's gamma-linoleic acid, omega fatty acids, it's known to help regulate hormones as well. So you can see there are many, many benefits. With women interacting with receptors in our endocannabinoid system, it alleviates these symptoms, as we mentioned, mood swings, cramps, breast tenderness, you name it. So cannabinoids work. Hemp CBD, we have amazing products back there, really, really impact the body in many, many areas of the body. CBD indirectly binds to receptor sites. THC directly binds, which is why we have that psychoactive feeling quite quickly. You do not have that with CBD. Okay. So, can we use CBD? We know we can take it orally. We know we can use it topically, transdermally as creams. Did you know that the female reproductive tract endocannabinoids receptors are widespread? They are the most dense in the vulva, uterus. They are the most dense in the uterus, fallopian tubes, ovaries, vagina, and vulva, anywhere where they can exert control. So the nerves where they mediate sensations, immune cells where they control inflammation, glands where they influence hormone secretion, muscles where they facilitate energy storage. That's what CBD does. That's pretty cool. I love CBD. Overall, the endocannabinoid system is fully integrated in the reproductive tract and has a vital role in pregnancy and childbirth. Beyond its role in reproduction, this system also influences the pleasures and pains and the reproductive tract provides on a day-to-day basis. So, a growing number of women are applying phytocannabinoids directly to their vulva, which we're going to discuss shortly, to increase sexual pleasure. Did you hear that? When phytocannabinoids are applied to the vulva, they increase blood flow, vasodilation. This works for men as well. Right, who wants the cream now? Wait, but then that means everyone will be running to the bathroom, and we don't want that. Exactly. And then with a smile on their face. Did you bring an entire box of the CBD cream? Alrighty, so you can see we talked about CBD and how it alleviates PMS. Here we go, hormone imbalance, anxiety and stress, amazing. CBD is amazing for anxiety and stress, okay? So let's go past that. This is me at the farms. I'm very big advocate of cannabis medicine, and you want to make sure that the quality is good. That's why I only lecture with, very good companies that are all about quality and what they put into their products. Because remember, CBD does have to be broken down, and if it's broken down improperly, because there you have multiple cannabinoids, it can be carcinogenic if it's not a good product. So you want to be very, very careful of the quality. So when I go out to the farms in Colorado, I'm making sure that these farms are organic, they're CO2 extracted, there's no pesticides used at all. You can see little ladybugs on there. So I'm all about the cannabis. Here we go, testimonials with using CBD topically. You can see here, this patient had a precancer, it was a benign, squamous cell skin cancer. He was taking CBD orally, as well as some supplements, and also topically. You can see how it was starting to extrude from the skin, coming out and completely gone here. You can see it more in your pictures. CBD works. It makes a huge difference. Let's talk about hormones. Again, lab work and hormones, how we're assessing the hormones, okay? Oh, this one's very blurry here. So when we are doing lab testing, our labs are about 20 pages, anywhere from 16 to 20 pages, because we're assessing exactly what's going on in the body, from hormones to your metabolic processes. I mean, you name it, we're looking at it, and we're seeing, and genetics. So we want to get the entire picture of what's going on. So in this slide, you can't see it, but we're looking at this. Here is a 67-year-old female patient we're checking estrogen because she's in menopause. Remember, that's the menopause hormone. Estradiol, progesterone, we're assessing her hormone levels. We can see here if there's an imbalance. We're looking at everything from her lipids. We're looking at additional markers here. We're looking at comprehensive metabolic panel. We're looking at her enzymes. We're looking at her red and white blood cells. We're looking at food testing. We're looking at beta cell function, insulin resistance, glycemic control, thyroid. We are really making a huge look. It's almost like looking into your biochemistry. Let's pinpoint exactly what area we need to address. That's where fine-tuning comes in. How can we treat something? Yeah, we can go based on symptomology. We'll talk about that a little bit later because peptides are good for that. But when it comes to hormones, you need to see exactly where they're at. So with that, we also do what we call the brain testing, neurofocused brain testing. This is our urine testing that basically tells us exactly the levels of where your neurotransmitters are. This actually is my test in 2018 because I started feeling fluctuations in my hormones and I was feeling a little, ooh, I'm like, this is just not me. So I said, let me actually take this neuro test to see exactly where I was at. My serotonin was starting to drop, my dopamine was elevating, my norepinephrine was low, my GABA, you can't see the ranges there. The range here is 550 to 750, I was at 1477. I was really dosing myself with a lot of supplements, and that's another thing that patients do. They start overdosing themselves with vitamins, and oh, this is good. We call it the Google, the University of Google or Google University. You become a doctorate in that because you start researching all these things that are good for you. You start taking all these different things, but guess what? There are interactions too. So therefore, I always tell patients or people, go to a practitioner, go to a physician that can help you put all of that together. I have all my patients bring their vitamins in. I want to know what they're on because a lot of vitamins that come from Walgreens or they're just not quality vitamins. They're loaded with chemical fillers. They're not good for you. So they're causing all these secondary effects. And then the time that you take the vitamins also makes a difference. So I put that together for them. I'll tell them this is a great vitamin, let's put that, and I write everything out, AM, PM, lunch, before dinner, after, however that may be for them. And that makes a very big difference for someone because we're busy. You can't remember what to take, but if it's in front of you and you handhold, that's where the compassion comes in with medicine today because people are busy, everyone's busy. They just want, please help me, just show me what I need to do. You write it out, it makes a huge difference. And for me, it works because what does it create? Compliance. And that's key. You want the patient to ultimately get better. That's why they're coming to you. So when you can help them any way that you can, it makes it different. It makes it so much easier because if not, they're calling you, a couple of times a day. When you just do it right from the very beginning, you're going to see the efficacy of that goes a long way. So we talk, when we give the reports, we're giving them clinical and lifestyle notes. So again, just talking about what I mentioned, we're talking about what to eat, what not to eat. So our approach to harmonious health, thorough assessment, I just mentioned that, comprehensive labs, pre-visits. We're looking at specialized lab testing. We do everything from heavy metal testing to food intolerance testing to genetic testing. We do quite a fatty acid testing. We do quite a bit to see exactly what's going on in the body. And then at that point, then and only then we can move forward as to what the recommended therapies may be for them. Okay, hormone replacement, let's talk about that. Now, we have imbalances in hormones, what to do with them and how to address it. Hormone therapy info, used to replace hormone deficiencies or correct imbalances. Okay, so what are those? Let's go through the definition of a bioidentical hormone. Safety concerns following the report of the Women's Health the WHI reflect increased interest in natural or bioidentical hormone treatment. So what is the definition? Plant-derived and similar to those produced by the ovary. Compounded formulation of hormones according to individual specifications based on salivary hormone concentration, because I get that often. Where is it made? How is it, where is it coming from? So we understand now the definition of bioidentical hormone. So now, these are the benefits of bioidentical hormone replacement therapy. You look and feel younger, increased libido, improved sleep quality, improved mental acuity, eliminates hot flashes. If anyone has experienced a hot flash, it feels like you're just sitting there and you are on fire. And that's not a good feeling. And some people exhibit it with sweat on the outside and some don't. I've experienced it, but I'm not sweating on the outside, but inside, I'm on fire. And someone could touch me and the heat is burning. And that's not fun. It balances mood. We're gonna talk about mood in a second with respect to how we're feeling and how we can help that as well. What are the pros and cons? We spoke about pros and cons earlier today with respect to hormones, okay? Increase of risk in heart attack, blood clots. You have to be very, very careful. Not every candidate is a good candidate for hormone replacement therapy. Hence, testing, testing, testing. That's vital. And I say that all the time because I have patients, oh, I want this, I want this, I want that. Okay, let's take tests. No, I know I have the symptoms. Not gonna happen. Testing, testing, testing. Okay? Reduced risk of colorectal cancers, these could be pros. Fewer fractures because it's helping with bone density. So check with your doctor before deciding to use bioidentical hormones. Benefits. These are amazing benefits. So a lot of women are scared, I don't know, I've heard so many bad things about bioidentical hormones. They cause cancer. You have to really do the research, but that's why you go to a professional physician that can explain all of that to you. If someone asked me, should I use bioidentical hormone? Yes, considering the source, okay? Considering the testing, considering the patient, the history of the family. There's a lot of things that were variables that we're looking at. But you can see here, hormone replacement for men. This is what we heard earlier today. It improves energy level, muscle mass and tone, sex and drive, you name it. Regrows hair on the scalp. Men, this one's for you, right? Every man should be on a bioidentical. Decreases joint pain and muscle aches, bone strength. Here, for women, eliminates night sweats, those hot flashes, vaginal dryness and itching. That's very big for a woman when going through menopause because that's gonna happen. It's just the sad truth. And so it becomes sexual intercourse very painful for a woman, and it can also produce a lot of UTIs as well. So bioidentical can help this. It improves fat loss and muscle tone, sex drive, improves mood, memory and concentration, decreases skin wrinkles. Women see that, they're like, sign me up. No one wants wrinkles today. We're always trying to reverse the aging of time, the age of time. Protects bones from osteoporosis. Reduces risk of heart disease. Okay? So, bioidentical hormones. We had an amazing doctor who is a compounding pharmacist talking about the compounding of the bioidentical hormones. Okay? So, let's talk about actual pellet therapy. So, we've assessed that with bioidentical hormones, you get better sleep, more energy, you lose weight. The bioidentical hormones have the exact molecular structure as hormones produced by your body. So your body knows what to do with them, okay? Research shows that hormonal decline is associated with the loss of body function and increase in disease. Hence, what is that statement saying? Should you get bioidentical hormone if you're in a menopause? Yes. Again, considering the facts, though, the variables, family history and the like, and testing, testing, testing. So what are the methods of bioidentical hormone delivery? We have them in capsules, there's creams, there's troches, there's pellet therapy and peptide therapy. Pellet therapy is my favorite, and I'll talk about that. So what is the right bioidentical hormone for you? Okay, we looked at what they do for you. We know now that they come in oral creams, patches, there's patches as well, injections for men, and then pellet therapy. We're looking at where we're at on the scale Pellet therapy is up there as an optimal therapy, and then there's peptide therapy. So what is a bioidentical pellet? Has anyone here heard of bioidentical pellets? Bioidentical pellets are I love them. I personally use them. I'm a CrossFitter, so I'm very, very active all day long. If you tell me I can't have bioidentical pellets, I'm gonna be the 7 dwarfs of menopause, because I love bioidentical pellets, because they really make a difference. Improved weight loss, improved sex drive, improved mood and emotional balance, energy, sleep, cognition, and memory. So they're cylinders, they're discs, they're tiny, highly compressed discs and cylinders containing pure bioidentical hormone, the same that are already, as I mentioned, that are present in the body. They're placed directly under the skin, very simple. It is such a tiny incision. Men get 3 different tracks. Men will typically get the bioidentical implant on the flank area, women in the glute area. Women get only 1 track, on average about 100 milligrams they're receiving. Women that are more active, about 125 milligrams. Men can get anywhere from 1,200 to 1,500 milligrams, because it is their main hormone, with an aromatase inhibitor implanted as well. And it's a slow release. So it's slow release to the body, and you feel that increase gradually. So you start to feel the difference. There's differences. With men, they have the testosterone injections. They inject, increases, decreases, which is why they're injecting every day. It's a matter of preference at that point, and it's a matter of finances. Typically, on average, sometimes testosterone can be covered by insurance. Pellets are not. Pellets are not. Peptide therapy. Everyone's heard of peptide therapy? I love peptides. Peptides, there's over 7,000 peptides. There are many, many different types of peptides, but many with great improvement with respect to, again, everything that we've been talking about, sexual function, libido, whatever, if you have different pieces really making a difference in helping you when you cook. Do you cook with 1 ingredient? Well, maybe some people do, but on average, there's different ingredients that you mix together to create this concoction so that it tastes good. Same thing in our body. Sometimes we need different concoctions to make our bodies feel good in different areas, because you can see how intrinsic and how complex we are. So you can see here, this is peptide therapy. It promotes growth hormone. We know that we start to lose growth hormone in our 30s. What does that mean? You start to age. You're not feeling as well. The muscle recovery is a lot slower. Enables faster weight gain or weight loss. I'm usually working with weight loss. Enables anti-inflammatory capability. So there's a lot of great things with peptide therapies. So what are they? They're a small chain of amino acids that improve cell signaling in the body, okay? So most of them can act like neurotransmitters, while others act like hormones in the body. They influence how our bodies react to diet and physical exercise. So as I mentioned, as we age, in our 30s, we start to decline with growth hormone, okay? So the peptides have the ability to give you that growth hormone, okay? What can peptides do for you? Dozens of things. Like I mentioned, there are over 7,000. This is what I was talking about earlier when I said this is where you can go based on symptomology. We're always testing, but based on symptomology. So if you have an injury, with your shoulder, just using that as an example, do you have to have a test for it? Not typically. If you're wanting to repair it, let's say you hyperextended your shoulder or something to that effect, or ankle, whatever that may be, you can use BP 157, which is amazing for acute injuries and things of that nature. We'll talk about a few in a second. So peptides have dozens of uses, but the most common are to help build muscle, reduce fat, improve energy, improve sexual function, reduce GI and musculoskeletal inflammation. So we're going to go through, and you can see again, these are the more comprehensive list of benefits. Okay, we talked about muscle growth, improvements in workout and recovery. As we get into those higher ages, muscle recovery is a little more difficult than when we were younger. Reduced body fat through lipolysis, the breakdown of fat, increased energy, stamina, and strength, strengthening of the immune system, thymosin alpha-1 all day long, improved regulation of other hormones, and we're always looking to increase that libido. So these are the peptides delivery. They're given either, you can inject them, You can take them orally, topically, nasal spray. My regimen, I take dihexa, C-Max, which is for the brain. I always am working on mental cognition. I take BPC 157 because I work out all the time. I also take CJC ipamorelin at nighttime to help with my growth hormone production. I want to stay younger. Do I want to, move forward? I want to reverse that AGE I want to reverse the hands of time because I'm in this industry. If I'm suggesting something to someone with integrity, I'm going to say, yes, I have taken it, or no, I haven't, and I'll investigate it and research it for you. But I'm a product of my own therapy. And I can tell you, I feel amazing. I'm going to knock on this wood right here because everything is about lifestyle. And again, how many bodies do you get? I got one. And this is what I'm going to protect. In Spanish, we say numero uno. We protect that. So there is thymosin alpha 1 and beta 1. There's CJC 1295, which is the ipamorelin. There's simorelin PT 141. Oh my gosh, that one is amazing. That is specific for that area right there, stimulating blood flow. You will actually have increased libido with that one for sure. There's MOTC, which is great for weight loss. BPC 157, I talked to you about this, for injuries. And it's not just, they have so many areas that they cover with peptides. Peptides are amazing. Deep sleep, DSIP stands for deep sleep induced peptides. People that have chronic sleeping issues that have been on Ambien, which is frightening because you shouldn't be on that for a length of time, as I hear, as I see some people on. Go on something that's better. It's more natural to the body. These are one of our ads that we put out. We put out a lot of ads on peptide therapy. Thymosin alpha 1 has been used for immune dysfunction. Right now, during this whole pandemic, I can't even tell you how much thymosin alpha we were putting out there because why? We need to build our immune system, protecting ourselves from this virus that's there. Hepatitis B virus, hepatitis C virus, certain types of cancers, arthritis. You have to be very careful with family history. Anything that I talk about with respect to any type of injectable, anything that's going into your body, testing, and going through a physician that is well-versed on this therapy. Systemic lupus, chronic fatigue, Lyme's disease, autoimmune disease. I mean, there's so many amazing functions with peptide therapy that can really help your body. CJC, week 1, quality of sleep, recovery from workouts on week 2. Week 3, mental clarity, skin elasticity, week 4, body composition. That's all I saw. I said, sign me up, I'm on that. It's amazing. So what can simorelin do for you? The same things, athletic recovery. There's just different types of hormones. That's where you're going to assess which is going to be the right peptide for you. Okay. Again, I'm all about how we can do things naturally with foods, how we can boost our natural production of growth hormone. Vitamin D, reducing your sugar intake, limiting alcohol consumption, maintaining a healthy diet, never neglecting sleep, getting exercise on a regular basis. So hormonal, hormones that affect the moods. We talked about this earlier. Thought you were in a good mood? Yeah, that was half an hour ago. Don't you feel like that? We're just like an up and down swing sometimes, ladies, and that's just because we do go through different moods because of neurotransmitters, which we're gonna go through in a second. So your mood swings, you feel frequent changes in your mood. 1 minute you can feel fine, the next minute you're just like the FS, the fight starter. And you can just feel that coming through. How do we regulate that? It's about knowledge. We're going to talk about that now. Unexplained emotions, lack of motivation. You start to feel very depressed when your hormones are depleted. Okay, signs of these mood swings. Anxiety starts to kick in. Fluctuating blood pressure. Elevated or reduced body temperature, of course, the abnormal levels of hormone, and the abnormal bone density reading. Okay, is it possible to have happy hormones? I am happy. We're going to talk about that because we're going to create that frequency there. But yes, it is possible. So what is it that we're looking at to really balance these hormones? Noradrenaline, serotonin, dopamine. We talked about dopamine earlier, that pleasure reward cascade. Noradrenaline is your fight or flight, your energy, alertness, concentration. Serotonin, memory, obsession, compulsion. We're going to talk about how you actually, what happens in your body when love hits, And serotonin's a big one on that, and dopamine. So this is the interaction of the happiness hormones. We have, again, norepinephrine, serotonin, and dopamine. And you can see the interactions in between here. I'm not going to go through all of them because now I'm looking at the time here and I'm running a little bit behind. So remember this slide that I showed you earlier with respect to checking your neurotransmitters via urine? That's going to be a big one to assess where you have your excitatory and inhibitory neurochemical balance. We're looking at neuropeptides here as well because these are the guys that create the moods. And I found this interesting. You see the sadness, what it's looking like on these images here. Depression, blue, which is why they're saying it, you feel blue. It's really actually, this chemistry is actually happening in your body. Okay? So here are the roles of the neurotransmitters in the brain. Serotonin is the inhibitory neurotransmitter, referred to as the master neurotransmitter, which plays a role in the sleep cycle, depression, anxiety, carbohydrate cravings, and PMS. Okay? We need that hormone. A lot of medications are trying to suppress that, as we heard earlier today. Dopamine, it is both inhibitory and excitatory. Okay, it depends on the receptor site that it actually binds to, but it's responsible for motivation, interest, and drive. It is the joy-related hormone. And then, of course, your norepinephrine, the excitatory neurotransmitter, as well as epinephrine, and GABA is the inhibitory neurotransmitter that is often referred to as the nature's Valium-like substance. So we find out exactly what's going on with respect to that neurotransmitter and try to balance it naturally. Now, that's also a fine area as well because there's natural and sometimes medication is needed as well. So that also has to be assessed. Areas of the brain where we have our functions, so the frontal lobe basically going through all the different areas of the brain, okay? All right, let's talk about the fun stuff we came here for. The biology of the sexual function. All right, so the sexual response cycle consists of desire, arousal, and orgasm, both physiologic and psychologic. So the desire is the mental state created by the external and internal stimuli that induces a need or want to partake in sexual activity. Desire it may be said to consist of biologic roots, which in part are based on hormones such as androgen and estrogen. Motivational roots, which are in part based on intimacy, pleasure, and relationship issues. So cognitive issues such as risk and wish. Wish could be fantasies. Arousal is the state with specific feelings and physiologic changes usually associated with sexual activity involving genitals. So arousal may be said to consist of activation of thoughts, dreams and fantasies, salivation, sweating, cutaneous vasodilation and nipple erection, clitoral, labial, and vaginal engorgement. So orgasm consists of multiple sensory afferent information from trigger points such as your clitoris, labia, vagina, breasts, creating an altered state of consciousness. So pleasurable sensory information is also carried to the cortical pleasure sites. That's the frontal brain. All right, so here's the anatomy, okay? So we have your clitoris, and actually, a lot of women are not aware. It looks like a wishbone. That's how big your clitoris is. Most people think the clitoris is just this little, gland that's there. It's actually quite big, okay? So you can see that. We're gonna talk about the G-spot, the anus, the clitoris, the vagina, and then obviously the men's genital as well, prostate, anus. But we're not talking about men today. We're gonna talk about women. So let's talk about the anatomy of the vulva, okay? Here, the vagina. Did you know that nerve endings are mostly 1/3 from the vaginal opening? So you don't necessarily need super long equipment for maximum pleasure. Did you hear that, men? Guys, stop worrying so much. The clitoris Most of us know this little gal, but it's actually not that little, as I showed you. It looks like a wishbone. You can only see a fraction of the clitoris. It is the shape of a wishbone and extends about 3 inches into the vagina. Here's a fun fact. The word clitoris actually is key word for, fun fact, clitoris is the Greek word for key. So that means that is the key to the pleasure. All right, the G-spot. If you were to insert a finger a few inches into the vagina and make a come here motion, you're going to be hitting that G-spot. It's about 2 to 3 inches from your vaginal opening in the front of the vagina. So you, right, and say, come on over here, okay? And then we know all about the anus, which I'm not going to get into. So the vagina is the muscular tube that links to the cervix, which is the lower part of the uterus. Also called the birth canal, the vagina allows for the passage of blood and cells in menstruation, the introduction of sperm during sex, and the delivery of a baby and the placenta at the end of pregnancy. The vagina actually has limited nerve endings, which is thought to be important to help women cope with the pain of childbirth. Thank goodness. Anyone that has had children knows it's painful, very painful. So the less nerve endings we have there, the better. We need those nerve endings in other areas, which we'll talk about now. The external part of the female genitals is the vulva. It consists of the labia majora, which is the outer fold, the labia minora, the inner fold, the urethra, and clitoris. The size of the vulva is unique to each woman. So now let's talk about the clitoris. We have to understand our female anatomy, and that's oftentimes when is this really, like, I feel like it's an echo. Is it really loud or, okay. While many think that the clitoris is a small spot just above the vaginal opening, as I showed you, it is in fact a much larger complex, which is about 16 millimeters in length. The glans, which is this guy right here, okay, that guy right there, is covered by the prepuce, which is the skin from the vaginal labia. Some people liken the prepuce to foreskin. The clitoris is an erectile organ and is thought to be the heart of the sexual female arousal. The clitoris is highly innervated with the densest concentration of nerve fibers found in the glands. These nerve fibers respond to stimulation by causing swelling and erectile tissues of the clitoris. Okay, so when that happens, we start our sexual function. The main thing that we're looking at are what? Orgasms. There are 7 types of orgasms that we consider the sacred orgasms. The clitoral orgasm, the nipple orgasm, the G-spot orgasm, the anal orgasm, the urethral U-spot orgasm, the A-spot, and the vaginal orgasm. So let's go through that. Sexual responses. In simplistic terms, genital arousal is characterized by increased blood flow to the pelvic region. In females, this vascular flow results in clitoral engorgement, an erection and accompanying vulvar swelling and vaginal secretion of fluid. When a threshold is released, orgasm follows. So the activation of the nerve pathways triggers that pelvic floor muscle. This is what we were talking about earlier, moving that pelvic floor, getting used to that motion. We'll talk about that in a second. Contractions that accompany sexual satisfaction. 4 major nerves bring signals from women's genitals to the brain. The pudendal nerve connects the clitoris. The pelvic nerve carries signals from the vagina. The hypogastric nerve connects with the cervix and the uterus, and the vagus nerve travels from the cervix and uterus without passing the spinal cord, making it possible for women to achieve orgasm. So let's talk about this G-spot. This is it in a blown up version, so you can see exactly where it's at. So men, there's no reason why you can say you can't find it, because here it is in full-blown version for you. So we can see the G-spot is where the orgasm begins. Located 2 to 3 inches, as I mentioned, inside the vagina, the G-spot contains a huge amount of pleasurable nerve endings. and it is found to have a rough texture. It is said that orgasms can be elusive, but are explosive and often leading to leg-shuddering sensation. That sounds like a winner right there. So let's look at the stats. Orgasm stats. Time taken to reach orgasms. It takes women a heck of a lot longer to reach orgasms. We can see here, male, about 4 minutes for orgasm. They're already done. Females, 10 to 20 minutes. We need a little bit longer time, gentlemen, so remember these stats. Orgasm duration, 5 to 22 seconds, 18 to 20 seconds with women, so kind of relative there. Orgasm with age, loses capability with age. Unfortunately, men do suffer as testosterone starts to decline, and we do have, erectile dysfunction. With women, over 50% still orgasm over 50 years old. Orgasm success rate, 95% for men, only 69% for women. Most orgasms in an hour. That's pretty good, 16, wow. Females, 134. I like to see that study. Wow. And this is what a female, we looked at slides, I'm into these type of colors, this auric fields and things of that nature. This is what they're showing that a female auric orgasm looks like. So colorful. Okay, so unfortunately, some women do have difficulty with orgasms. That's called anorgasmia. It is a type of sexual dysfunction in which a person cannot achieve orgasm despite adequate stimulation. So you can stimulate her to death, the orgasm is not going to occur because we need to treat underlying conditions. So if a medical condition is hindering that ability, you have to resolve it. We need to start looking at the hormones, seeing what's going on with the hormones. Obtaining estrogen or testosterone therapy for postmenopausal women. If anorgasmia is associated with menopausal symptoms such as night sweats and hot flashes, systemic hormone therapy may relieve those symptoms. Or local estrogen therapy in the form of a vaginal cream called oxytocin scream cream. Who wants the scream cream? I have some in the back if anybody needs any. I'm just kidding. That increases blood flow to the vagina and helps to improve sexual arousal. The use of radio frequency vaginal rejuvenation and regeneration is extremely beneficial in sexual dysfunction. Okay, so let's talk about this, the designer vagina. We want to fix our vaginas. Guess what, ladies? They are aging as well. So we need to fix what's not working. The designer vagina is gaining popularity as women feel that they're getting their juicy. You hear me over there? Jamie, we're getting our juicy back. We're finally talking about it. Getting our juicy and sexy back. Whether you're in your 20s or whether you're in your 60s, it's no secret that our body is aging, okay? So guess what? We start to get wrinkles. We start to feel the nuances of age. Oftentimes, women never look down there, and guess what? Our vagina ages as well. So we want to start to work on areas that are going to make a difference there. Women in childbearing years, we've had pregnancies, the years of sexual activity, weight fluctuations, hormonal changes, high impact workouts as well. They have a marked effect on health and appearance of your vagina and vulva. So some of the most common feminine concerns related to this include elasticity and wrinkled appearance of the labia and vulva. And by the way, I have pictures. Tracy, now we talked about this in the last seminar. I can show you pictures. On my phone, I have them on my phone. I couldn't do them here, but vaginal dryness, low blood flow and sensitivity, pain sensation by labial hypertrophy, urinary incontinence, urinary tract, infections, this is huge, UTIs, vaginal yeast infections. A lot of women suffer from vaginal yeast infections, and what do they go? On antibiotics, which then suppresses, it's like a vicious cycle. There are therapies that you can do that may not consist of the antibiotics, and of course the decreased levels of sexual interest. Okay, so this is what happens when a woman is suffering with vaginal yeast infection. There's actually yeast in the vaginal canal. With respect to the radiofrequency therapy, which I'll talk about in a second, a wand actually goes into the vaginal canal. This yeast actually sits in pockets on the sides of the wall. And as I'm going through the vaginal canal with the radiofrequency device, I see those pockets just drop and the yeast starts to come down. There's other things that we do as well, but this helps with the with the vaginal canal. So let's talk about that pelvic floor that we were dancing to and moving our hips to earlier. It is actually, your pelvic floor is a sling, essentially. Like, it supports the organs in your pelvis, including the bladder, rectum, uterus, prostate. Contracting and relaxing these muscles allows you to control your bowel movements, urination, and for women particularly, sexual intercourse. Who here has heard of Kegel exercises? Of course. I'm doing a Kegel exercise right now as I'm standing here talking to you. We can do that all day long. We're actually strengthening those walls by doing that. That's really important because there's also pelvic floor dysfunction that really impacts women today. So if we can work on that alone, just by sitting there, you can cook, clean. I'm walking around, I'm doing my Kegel exercises. Nobody knows that I'm doing that, but I'm doing them, right? And I'm strengthening my pelvic wall because I want all the benefits that I can get. And I told you, there's little pieces of the puzzle that make a difference. So you can see here, better urinary control, better intimate experience, and relief from back pain. And it's not just in the sexual function, it really makes a big difference with, an anatomical structure and anything that has to do with skeletal. Okay, we just talked about that. Pelvic floor dysfunction symptoms. If there's a dysfunction in this pelvic floor, you have pressure in the pelvic region or rectum. There are urinary issues such as urge to urinate or painful urination. There's constipation, bowel strains, lower back pain, discomfort during sexual intercourse, muscle spasms in the pelvis. There's a lot of things that happen if we have a pelvic dysfunction. So let's keep that pelvic floor nice and healthy. You can see here that in childbirth, pelvic floor dysfunction usually does not occur due to one-time events such as childbirth. Repeated heavy lifting, hip or back injuries can cause the pelvic floor to weaken. Low hormones absolutely can cause that to weaken. So there are many different nuances that cause weakening of the pelvic floor. So these are some exercises that you can do, Kegel exercises. What I often tell women, and I'm gonna actually have to lift this because you can't see this. I'm going to go sideways. Do you see how, I got a big booty, sorry about that, but see how I'm squeezing my cheeks, but I'm bringing them forward? That's actually what the exercise looks like. So when you're walking, try to squeeze those cheeks because you're actually bringing your pelvic floor forward and helping that and strengthening that area. Okay, the O shot, oh my goodness, finally we're here. What a great topic. How can we get to that area? We talked about the clitoris. We talked about it as the anatomy of sexual pleasure. And if it's not working properly, how can we help them? We can do the O shot. The O shot is a series of injections into the clitoris. There's about 3 different injections that we can use. We can use your own blood, PRP, platelet-rich plasma, where we take your blood, separate it, and then we extract the plasma. That can be injected in there. There's also amniosomes, which are exosomes, signaling molecule that can also be injected into that area. Amazing. If anyone has even considered or thought about doing an O-shot, look into it. It is a really great therapy. It's quick. You numb the area. It's a few injections, but the benefits are very long lasting, and you feel because you now have blood flow, you have better vasodilation in that area, so your stimulation is gonna feel better. You'll see a big difference with that. So it helps to decrease urinary incontinence. Again, not just for sexual interaction, it has many benefits. So younger, smoother skin of the vulva, increased sexual desire, increased natural lubrication, tighter introitus, which is a vaginal opening, greater arousal from clitoral stimulation, stronger and more frequent orgasms. I guess that person with the stats had this therapy done because 134 orgasms in 1 hour is that's pretty intense. So here's the radiofrequency vaginal rejuvenation. This is Votiva that we use in our office. I love this therapy. I see amazing therapy, amazing effects with this therapy. It is about 30-minute treatment where I'm inserting a radiofrequency wand into the vaginal canal. And I'm rotating those areas. That vaginal area is actually really inducing collagen in the area. The energy gently heats the vaginal tissues and stimulates the tissue renewal process and the production of collagen, okay? So what happens is it stimulates nerve regeneration to provide increased vaginal sensitivity, improves sexual satisfaction 100%. And I say that with respect to myself because I love this and I'm very honest. I talk about things because there's no reason to be afraid or keep things to yourself. I'm very open with talking about women's health because it's what it is. And we need to understand how to do it. There's no secret, there's no hush-hush anymore. And I'm glad that we can finally bring this in a clinical context to women so that we can know what therapies there are to help us in these areas. So it also addresses vaginal dryness, vaginal laxity, urinary incontinence, and it is amazing with urinary tract infections. I get a lot of women that come in that suffer with urinary tract infections, 3 treatments, and they're doing really, really well after that. So that's one therapy. This is another one that we have with radiofrequency with respect to skin tightening. You can see here she had a lot of crepey skin. We also did radiofrequency there. She did some PTE threads as well. This here, fat in the neck area. No woman wants fat in the neck area. You can see how she no longer has that. This here is, actually this is my friend. She allows me to post this picture. She's a CrossFitter. She works out all day long. She could not get that fat out. That's her now after radiofrequency therapy. So RF is a controlled heat to stimulate the production of collagen and tighten the skin. So let's talk about, okay, let's wrap this up. Attraction, what happens when we're attracted? So now we feel amazing, right? Because we understand what's going on with our hormones. We understand the interaction of our neurotransmitters, how to affect our moods, what's going on in those cycles, balancing the hormones with whatever therapy that may be for you, whether it's bioavailable hormone, pellets, creams, whatever that is for you, peptides. We're feeling great. What happens? We're ready now. Let's get into a relationship. Let's talk about that. Okay, what actually happens? Here are the neurotransmitters we were talking about: norepinephrine, serotonin, and dopamine. This is the infatuation stage. See, men get hypnotized. That's what happens. We really have magical powers. We're talking about this in the medical terms, but we really have magical powers. Just kidding. So this is what happens here. So we have lust, right? We like somebody immediately. We see someone, oh, there's an attraction going on. Testosterone and estrogen is surging. The attraction happens, dopamine starts to stimulate norepinephrine and serotonin, but we want to suppress that guy a little bit, because if this guy gets a little high serotonin, then we have a stalker. They become obsessive. We don't want that. Then we have the attachment, vasopressin. There's that oxytocin again. Oxytocin is that bonding neurochemical. Okay, so let's go to here. So here it is, the love hormone. We consider that the love hormone. Whenever you find yourself filled with love, it's because of that hormone, oxytocin. So loving that chocolate, that's oxytocin. Actually, chocolate is rich with anandamide, which is CB1 with cannabinoids. Loving each other, thanks oxytocin. Ooh, yeah, that must be that orgasm. You stimulate oxytocin when you're having orgasm. Breastfeeding, that bonding, that's all oxytocin that's happening in the body. So now we have this oxytocin surging through our bodies. It's now touching yourself or showing your mate where to touch yourself. So we have what we consider erogenous zones, right? Let's look at this. Women erogenous zone, the nape of the neck. Women love to have their hair touched, their neck touched, her gluteus. Ground zero, we know that. That's the vagina. We talked about that, the G-spot and the clitoris. Caressing the breast, because we have also sensory there with the nipples. Here we have a couple of different areas as well. So according to shapes, I'm not sure about the armpits, but this was on there. Crook of the elbow, the fingers, the curve of the ankles. I found this one to be fun. So let's see, men and women ranked each of their hot spots from a scale of 1 to 10. So here are the men. Let's go through, I can see it here. Men, mouth and lips was 7.03. The nape of the neck, not so much. Pubic hairline, the penis, of course, was the highest. Then with women, mouth and lips were high, the breasts were high, the clitoris was the highest. So I found this even more interesting. We have erogenous zones by zodiac signs. Who knew that? How interesting. So we can go through whose zodiac sign is, is what, and we can see which is going to be your erogenous zone. You have that on your paper. But, Taurus. Who here is a Taurus? Okay, neck and throat. Cancer, stomach and breast. Virgo, waistline and booty. Scorpio, your genitals. Yes, Scorpios, they're like the strongest sign in the horoscope with respect to sexual function. Scorpios in the house. Okay. Aries, hair, head, and ears. Gemini, arms and shoulders. Leo, heart and back. Libra, lower part of the legs. And Sagittarius, inner thighs. Not going to forget the Aquarius, ankles and calves. All right. So, women, and then we're going to wrap this up with this. Oftentimes, we have what we consider sexual problems, whatever that could have been cyclical from childhood, whatever that trauma may have been. It could have been bad relationships. Moves forward, but guess what? Those engrams are still there. They're memories that are locked in the body, which can create sexual dysfunction with personality traits. Okay, so there are 7 common personality traits that may predict sexual hang-ups that you can see in the bedroom. So let's go through them. Which sexual character are you? We have the ice queen, we have the mommy martyr, the alpha boss, the self-conscious spectator, the pedestal princess, the blessed but repressed, and the multitasking woman, okay? So the self-conscious spectator, she's always worrying about everything. Oh my gosh, I don't look good, I'm fat, I'm this, I'm that. Mental chatter and self-judgment. Creating difficulties with orgasms because she's just so uncomfortable with her body. How about the alpha B or the alpha boss? Her character traits are domineering. She's the queen, she's the masculine, she's the polarity, both female and male energy. Strong, edgy, bitchy, sexy, but can be intimidating. So the alpha B has become so masculine, she finds it difficult to be the girl in the relationship. She's both male and female. The ice queen, cold and frigid. Sex is a thing of the past. The mommy martyr, she's overwhelmed. She sacrifices herself for her family. So she sacrifices her self-pleasure because family's first. Then you have the pedestal princess. She's so pretty. She's doted on. I'm so gorgeous. No one can touch me. Her standards are so high and untouchable that she keeps herself sexually frustrated. Blessed but repressed, religious beliefs, spend so much time in church. It's ugly, it's sinful, sex is not for me. Bottom line, sexually repressed. Multitasking, superwoman, mompreneur, always busy, juggling every task to the point where she's physically exhausted. Guess what? Bottom line, loses sexual desire, sexually repressed. So, who wants to be that way? We have to figure out what's your sexual character. Be aware and cognizant of that because you don't want to bring that into the bedroom. Because what happens? Divorce. It eventually happens, or dysfunctional relationships, which leads me into the languages of love. Okay, once you have this great relationship, you have these beautiful hormones surging, you're feeling amazing, now you want to keep it. How do we keep our relationships functional and love and long lasting? Words of affirmation, acts of service, quality time, physical touch, and sharing means. So how to speak your partner's love language. Women are from Venus and men are from Mars. Men do not have ESP, ladies. You must communicate. We've learned about your erogenous zones, where you want to be touched, how you want to be touched, how often you want to be touched. Words of affirmation. You want to communicate. Actions to take. Spend time. Express yourself. Things to avoid. Don't say, oh, he doesn't know what I want. We're just making those stories up. You want to learn how to do that physical touch. We talked about the different areas that you can touch. Receiving gifts, thoughtfulness, okay, quality time, and acts of service. So I just say, remember, communication is key. You have to understand your bodies, really be cognizant of what is going on inside of you, how you feel, what you'd like to feel, and communicate that to your partner. Oftentimes, that is one of the number one reasons why we have dysfunction in relationships today. What is your self-love language? That's the first thing to understand. Physical touch, things that make your body feel good. Focus on your physical being. Massages, soft blankets, spa days, skincare routine. Okay, acts of service. Do something for yourself. Again, I talked about the sexual, the characters of sexual dysfunction. We're so busy, we just fail to take care of ourselves. Women, we take on a lot of functions. Everything is on our back and we want to do everything, be everything for everyone. But then we fail to take the time for ourselves. So that's important to love yourself first. Remember, numero uno, you'll remember that always, numero uno, you got one body and take care of that. So receiving gifts, quality time with yourself, and words of affirmation. That's where that vibration came in. I'm happy. Here it is. This is the ending here. The time has come for us to raise our vibrational forces and manifest your own positivity, light, and love. Nobody's going to do that for you. You have to do that for yourself. Just like you go to a therapist for whatever reason that may be, at the end of the day, you're the problem and you're the solution. They will only help you. So you have to help yourself. So that vibration is very important. We've heard of the law of attraction. We've heard of the law of the universe that says you are responsible for your life. You can manifest and change according how you direct your thoughts and emotions. Vital. That is 100% true. So when you are vibrating at a higher level, you feel lighter, happier, and more at ease, whereas lower vibrations feel heavy, dark, and confused. So how can you vibrate your vibrational frequencies? Gratitude, love. Show gratitude. Every morning I wake up and I say, how can I grow? How can I share? And how can I celebrate? Because you want to have fun enjoying it. Once you know what you need to do, enjoy the process. This is what's happening today in the society where our vibrations are so down here because there's so much chaos going on in the world. But we emanate vibration, so we can as a whole collectively make that difference with everybody. So eat high vibrating foods. Here's a frequency map of conscious level. This is a great book by Dr. Hawkins, Power versus Force. Positive affirmations. We are resonating in that 500 frequencies. Our body's made of frequencies, okay? We are frequency based. 528 is the love frequency. Just by saying I am happy helps you to bring you to that frequency and staying there. Tony Robbins, physiology, he talks about it. In 2 seconds, you can change your state, change your being. Physiology, by words, you speak, that's vibration coming out. So keep yourself at that 528 frequency. You don't want to be in these lower frequencies. Gender vibrational frequencies, believe it or not, males are 1 octave lower than females. Did you hear that? Of course, we're super beings, aren't we, women? That's right, we are super beings. The frequency pyramid, this is very important. High frequency foods, eating superfoods. Taking amazing supplements as we have with Nutritional Frontiers. Okay, some of our other therapies, I'm scooting by through this. Hormone-related patient case, we talked a lot about this today. Hot flashes, severe anxiety, low libido, vaginal dryness, weight gain, goals and priority were to lose weight. This was the protocol that I put her on. We gave her, yes, we did a full comprehensive lab, a micronutrient test to assess her vitamins, food allergies, and the neurotransmitter test. We put her on our multivitamin, adrenal boost, DHEA, her Estro Cleanse, Super B Complete, endocrine tincture, omega-3, and hemp CBD. She also went on bioidentical pellets. She did intravenous Myers cocktail. I have a Liquivita IV lounge in my practice, and radio frequency therapy. So again, these are the products that you heard earlier. Adrenamax all day long. I live on Adrenamax. I love this particular product. And we heard about all the benefits today. Estro Cleanse. These are vital products that make a difference. You're talking about a company that has put the time and research to put a quality product together for you. So Estro Cleanse creates that hormone balance with estrogen levels and relieving the oxidative stress that happens with that. So these are the ingredients in there with the Estro Cleanse. Great ingredients. Curcumin, we know that it scavenges free radicals. DIM, which enhances estrogen metabolism. Indocarbonyl. DIM Pro, here's the other one. DIM Pro creates an estrogen management system that helps you achieve your health and fitness goals, reduces the health risk associated with estrogen dominance. You don't want estrogen dominance. This is quite dangerous. Slow estrogen metabolism, proper hormone balance in both men and women. So this is not just for women, this is also for men. Really important, because when testosterone it climbs too much for men, it will convert over to estrogen. Hence, we have to metabolize that estrogen. So this is a really good product for that, okay? Super B, we talked about how important they are. They're important for neural function, neurotransmitters, energy production, focus, stress relief, nervous system, positive mood, cardio health. I love this. I take this every single day, and has all your B vitamins, especially your folic. It has the methyl tetrahydrofolic acid in there and the methylcobalamin B12. Okay, that's the same product. Omegas, we need good fats. Why do we say EFA? Essential, that's the key word, essential fatty acids, vital for the brain and for the heart. Hair, skin, and nails, supports blood pressure, inflammation. That's the product in there. I love this product, endocrine, very, very good. It's an herbal tincture, specially formulated to support the endocrine organs and balance hormone production. It is sitting straight back there. Check out that product. Here's your DHEA, mother hormone. Okay, the adrenal, it's produced in the adrenal glands, and this also the precursor to testosterone. So it supports IGF levels, which is insulin growth factor, and decreases levels of cortisol. Okay. Testo 180, we heard about that all morning. Fantastic product. Someone wants to come in that wants to just strictly do natural, functional medicine. They don't want to do a bioidentical hormone. That's what they're put on. Testosterone 180 all day long. Increases the testosterone circulation, and it balances their hormones. Okay. Tribulus, this is real. I love this product because oftentimes we're seeing men having a very low free testosterone, because that's what we're looking at. We're wanting to make sure that they have enough free testosterone to circulate through the body, and it helps to unblock that blocking potential. So this is really good. And here's the last slide. Self-love is asking yourself what you need every day and then making sure you receive it. Because you can ask yourself all day long, but then you never get around to doing it. Make sure you receive it. So this is my personal testimonial. I choose to make the rest of my life the best of my life. I do follow the best 6 doctors, which are exercise, water, sunshine, rest, good diet, and fresh air. Always doing the right thing. Letting go of what doesn't serve you. Let it go. We have, an indefinite amount of time. There's 2 things that are absolute in this world: birth and death. And everything in between is up to us. So we need to make it happen for us by really taking care of ourselves, finding out exactly what we need, giving ourselves self-love, and really making your life the best of your life. And it has been my pleasure to speak to you today. Thank you so much. Any questions? I'm in the back. We're offering discounts on things as well. Thank you.
Hi, I'm Jamie Dorley. I'm CEO, co-founder, and owner of Nutritional Frontiers, and we're breaking through nutritional boundaries. I'd like to let you know our mission is to make the world healthy, and the best way to do that is share our education. We like to welcome and invite all doctors, healthcare professionals, and staff to our professional training events coming to a city near you. You can attend these live, you can go virtual, or you can get the recording. Any way you like it, come and join us for a professional training event. We have fantastic speakers, great topics, and a really enjoyable atmosphere that is fun to learn and you can take these principles you learn back to your clinic to help you improve your patient outcomes and increase your practice profits. Thanks so much for all the support. Look forward to seeing you at a professional training event coming soon.